Warm greetings to everyone. I am Dr. Kanupriya Singhal, Health Specialist at the UNICEF Office for Uttar Pradesh. The topic of my project is enhancing the engagement of husbands and other family members for improving coverage and quality of antenatal care in Uttar Pradesh. My project is around the theme of centering women and girls in health. Now, talking about the problem, Uttar Pradesh, the state that I work in, is home to approximately 10,000 preventable maternal deaths, 165,000 neonatal deaths, and 24,000 stillbirths every year. We know that quality care in the antenatal period, including adequate nutrition, is a high impact strategy to reduce maternal and newborn deaths and stillbirths. However, the coverage of antenatal care remains critically low in Uttar Pradesh, with only 62% pregnant women receiving the first ANC checkup in the first trimester and only 42% receiving 4 or more ANC checks. Now, global studies indicate that engaging husbands and family members has a positive impact on improving the coverage and quality of care of pregnant women, as you can see in some of those graphs. Also, husbands and mothers in law are the first people to come to know about the pregnancy, as was found in an assessment of behaviors related to maternal health that we undertook in 4 districts of Uttar Pradesh. However, the engagement of husbands and family members in women's health is low due to a complex dynamics, including adverse gender norms and stereotypes. My project primarily aims to understand enablers and barriers towards engagement of husbands and families in antenatal care and attempts to propose tested high impact interventions for scale up across the state. While I do recognize that when we talk about engaging husbands in their wives' health in a way highlights the issue of the lack of women's agency, but at the same time it is gender transformative from the lens of the value of the woman in the family and the gender stereotypes that men also face. So, I plan to undertake a qualitative study to evaluate the current practices, attitudes, and levels of involvement of husbands and family members in supporting pregnant women for early registration and quality ANC through a behavioral insights and human centered design approach. Subsequently, a stakeholder consultation is planned to co create social and behavior change solutions. They will then be field tested and iterated in selected districts. Based upon the field test results, successful interventions will be identified for advocacy to scale up the interventions across the 75 districts of the state. In terms of my progress with the project, I have finalized the terms of reference, including the study design. The study tools are ready. I have been able to identify and earmark resources and a partner for the activity. I'm currently awaiting internal procedural clearance, which is expected in February, and then I'm ready to roll it out. So, in terms of the outcomes, all of these activities and the outputs, they are expected to lead to increased early registration of pregnancies, enhanced frequency and quality of ANC checks, and enhanced engagement of husbands and family members in the care of pregnant women. Now, coming to the most important aspect, while the journey over the last 1 year has influenced many aspects of my leadership style, I would like to mention 3 specific aspects which I have used for this project. The first one is around authentic leadership. So, at the time of application, I had chosen a different project based upon my priorities at the workspace. But after the immersion, I was forced to reevaluate my choice of the project because I realized that while the project was important, it did not give me a sense of purpose. The gendered nuances affecting the care of pregnant women is something which really evokes passion and sense of purpose in me, based both upon my own experiences as well as the relevance for women's health on a larger scale. While the change of project put me out of my comfort zone, of which this was because it was around working mostly at the facility level, and this project requires me to work deep into the community, the sense of purpose drove me to delve into it with energy. The second aspect I would like to talk about is my influencing style. My influence style indicator report showed that my preferred style of influencing were bridging and rationalizing, while inspiring did not have a high score. This project provided me both with the need as well as an opportunity to use the inspiring style because of the novelty of the approach as well as the gender nuance. I use the power of storytelling through my own story and leveraging my colleagues' stories, by the way, all of whom are men, to bring them on board with full commitment. And finally, aligning and amplifying, because for this project, in addition to my own team and cross sectoral colleagues in my office, I've had to reach out to many colleagues in our central office. I will also have to work with stakeholders in the government at all level and some newer community groups, and I'm looking forward to it with great excitement. With that, I will end my presentation. Thank you very much.